I'm Katie Rammel alongside our ABC 15 data guru, Garrett Archer, and we are diving into the coronavirus numbers once again for you, helping you find the information you need out there so that you can make the best choices for your family and your life. And of course, Garrett, this has been a wild 24 hours. When we spoke yesterday, we were just awaiting the governor's news conference, and because it showed up on a Monday, we knew it had to be something pressing because we usually hear from him midweek, and boy was it, because there's a lot of changes. For those of you not in Arizona, they as of 8 p.m. last night shut down the bars, gyms, the few movie theaters that were open. Some were scheduled to open throughout the month, and they pushed the school in person start back date to August 17th. So quite a few changes, a lot of people talking about it over the last 24 hours. And of course, we've always been diving into the numbers, and we'll continue to help you find that information here today and hopefully give you a little bit of perspective as well on all the things that are coming out surrounding this. So if you have a question, post it in the comments, and we'll try to help you find the answers on the internet and show you the best way to get to those numbers and really dive into things. Now, yesterday was strange, Garrett, because one of the labs did not report by the deadline, and we had discovered it was Sonora Quest. You actually reached out to them, did some extra digging to find out what the numbers yesterday should have looked like if that lab sent their info in on time. Of course, then those numbers were added to today. So when you see today's numbers, when at first glance would look like a record. Not the case, because you would have to break those out into yesterday's numbers. What did you hear from Sonora Quest, and how did that change the numbers yesterday versus today?
So yesterday, the AZDHS reported 625 new cases with only 1,500 tests. And of course, while Mondays are typically a low case day, that is far lower than what we've had in a long time here in the state. So it was sort of obvious, because Sonora Quest is the biggest vendor for these tests, that it was Sonora Quest that had not reported. So we reached out to them to get the number of tests that were backlogged that they were not able to send over. What we found was that Sonora Quest, hold on, I'm pulling this up, I'm sorry. Sonora Quest had 2,454 cases that they were supposed to send over to AZDHS yesterday that did not get over there. So even though we only had about 625 cases, yesterday's case total, had it been reported correctly, would have been about 3,000. Now today we have, if you look at the AZDHS's site, we have 4,682 cases reported today, which is technically it's a record, but that 2,400 that I just mentioned was added into that. So when you factor in that and you take those cases back out, we only have 2,228 cases reported today, which is actually a fairly low number for Arizona right now. It's about a 4.2% case growth. Tuesdays have typically been one of our worst days in the last month or so. Like on June 23rd, for example, a week ago, we had a 6.6% increase, and the week prior to that, we had a 6.5% increase. So 4.2%, that's a pretty low increase. However, what we don't know right now is if there is still a backlog that has to be dealt with at Sonora Quest, and that we're going to be seeing a higher count tomorrow and the next day as they work through these numbers.
Yeah, so what we're hearing from are getting the call on like Tuesday or Wednesday after they had taken the test over the weekend. So Kelly Francis writes in, thanks for giving us the numbers. Kelly, we're happy to help you find what you're looking for here. And also TJ just wrote in, spelled T-E-J-A-Y, writes, I'm more concerned with the number of deaths. Now, we did get some reporting on deaths today. I believe it was 44, if I'm not mistaken, was the overnight number that came in.
Yes, 44 deaths were reported. We had very low death reports this weekend. I believe only one death for the entire weekend was reported. Now, weekends, there typically is very low death reporting on the weekends. So really, we want to look at Tuesday through Saturday. I know I said weekends, but I'm just because of the way the reporting works, it's really Sunday, Monday. When I say weekends, I'm referring to their daily reports on Sunday, Monday. And so we saw 44 today. So what we're really going to be watching what happens in the next 3 or 4 days. Let me share the screen with you really quick. I'm going to share what is called the epi curve for the deaths. This is the number of This is the actual date that's on the death certificate that's given to the AZDHS. This dark blue is what yesterday looked like, and what was added today with those 44 are these light blue lines. I have this yellow line, which is this one is a 7-day moving average, but I cut it off at 10 days because this takes a long time to fill in. If you look at this chart, it can be a little misleading because it looks that deaths are dropping off precipitously, but that's just not the case. This because there's about a 27-day lag with deaths. As you can see, they can go back about 12 days of filling in deaths. So we look at these, we monitor them, but we want to make sure we do want to see, of course, a lower trajectory on these, but we have to put them into context and make sure that we don't see this right drop right here and say, oh, look, deaths are going down, because that's unfortunately not the case quite yet.
Yeah, and some charts, you got to watch some of the lines that state how much of a lag we're seeing in those showing up before you try to.
I do have, exactly. I do have the also, one second, just make sure I'm going to the right thing. Nope, that's not the right one, sorry. Sorry about that.
As you're pulling it up, I'll just touch on a few things. Fauci was speaking to Congress today, and he said if there are any parts of the country that are at risk, you're putting the entire country at risk. You see how easily things could change if you have one hot spot, if you will. And so really right now, all eyes are on Arizona and how we can work to get this thing under control and work to get these numbers back to where they should be.
So this is, yes, this is the actual daily reported numbers. So instead of the actual date of occurrence, this is the date the health department tells us when that something has occurred. So this yellow line goes all the way to the end, unlike the others, which I cut off early to make sure that it doesn't show a drop every single time unless the drop is warranted. And this is the death numbers that are reported. As you can see, this 44 has been sort of a typical report. For weekdays, we did have a very high report last week, but it's sort of this typical line. You can see that at least as far as the reported number of deaths, they are at a high right now. But again, this report really is driven by numbers on a day-to-day basis. So even though it's showing a high right now, this could go back down pretty quickly if we start seeing other reports. And again, with deaths lagging so much, it's difficult to really get a finger on what's going on with deaths with the same accuracy that we have with cases and tests.
Right. I want to mention too some of these executive orders that came out yesterday. If you're looking for any of the information on those, or you love words as much as we love numbers, you can read the whole executive order for yourself. I posted all of them over on my Facebook page, and you can dig through and read a little bit more about the gyms closing and the bars closing and all the rules that are set up surrounding that. So Lee Jones writes in, will this affect the start of school? So Lee, what we know so far is what the governor told us yesterday, that the start date for in-person schooling is going to be pushed back to August 17th. So many of the schools were starting as early as July 22nd. My child's school was starting August 5th. So for most people, it's pushing it back a few weeks to the in-person schooling. They are allowed to start schooling though. So if you were going to do the distance learning, or they would like everyone to start the distance learning on that day, that's going to need to be looked into for your particular school district or your children or your grandchildren's school district. And you can find a whole section on education on our ABC 15 Facebook, website, abc15.com/coronavirus is all the coronavirus information. And then we also have a whole education system that has a deep dive into what each school is doing for the new school year and their plans, whether they're set in stone or they're being considered at this time. Jenny Doe writes, what does the shifting in the epi curve mean? So we've seen some changes in its high points as new numbers have been logged in. Yes. So obviously, because the epi curves are the actual dates of test collection, hospitalizations, and death, they do not follow the same daily reporting. So when it shifts, what that means is that another day is now the peak day. So I will share really quick the cases by day from the AZDHS to show this example. Here we go. And what
what this shows is on today, the peak positive case is now June 22nd, and that's 3,902 cases. Just yesterday, just to show you how quickly this thing can shift, just yesterday, that the peak case day was actually June 19th. And it was about 3,400 cases at the time. So what we're seeing right now with the epi curves is they are shifting forward. The peak days are shifting forward in the cases and the tests. That obviously is something we don't want, because this is not a cumulative number. This is a number per day. So we do want to start seeing this number go down. And eventually, you know, God willing, it will go down at some point, yes.
Yeah, we sure hope so, sooner rather than later. But yeah, we keep seeing the shift in that. So Jenny, thank you for the question. I
saw a question I wanted to, sorry, I did see a question I wanted to address. Yeah. It was a question about doubling times. And I do have a specific chart that I deal with specific to doubling times. So this is this is a county case growth chart, and it's a cumulative chart. And this is what's shown, the amount of time it's taken for each county in Arizona to reach a certain threshold, and it will also show the doubling. Maricopa, this is not a per capita, this is actually cumulative. So you can see right now, Maricopa is on a course to double the number of coronavirus cases that are currently there in 13 days. Yuma, 18 days, Pima, 16 days. Some of these other places, Coconino was at one point one of the hot spots, but it's now at 44 days. Gila is also 11 days. So you can see in this chart where some of the Arizona's counties are shifting and how they've shifted over time. And we move this to a case per capita, which is this basically standardizes the populations for all of these counties. And you can see that Santa Cruz, even though it has a days to double of 20, it is, as of right now, the highest hit per capita county in the state. And then you can see all the same numbers, but you can just see them sort of standardized together and see which counties are the hardest hit and which ones are not. This is on my Twitter account. It's a little difficult to share the URL for this, so I'll just make sure that I post this again on my Twitter account.
Yeah, can you toggle between those two charts again to show people how those change?
Yeah, and Maricopa obviously is the largest population center in Arizona. That's no question. So this obviously will have the most number of cases. And you can see that Yuma and Pima have a sort of equal number of cases, but they certainly do not have an equal number of population. And then all of these other sort of smaller rural counties. And this sort of shows, you know, and it's got these little lines to see what angle the line is going is when it's technically going to start doubling. And then this per capita is, again, the same chart. It's just equalizing the populations so that you can look at La Paz County, which is a very small county, Greenlee, 10,000 people in Greenlee, and put them on the same chart with Maricopa and see who's being hit the hardest in terms of the rate of their population rather than just raw numbers.
So which do you like the best, Garrett? I mean, I always like to take out any other factors so that I can get a real understanding of how things are changing. But which one do you tend to lean on the most?
I tend to lean on the per capita numbers more than the raw numbers because it is a better indicator of where the cases are or where the shift in the infection rates are going. And you can sort of see this. I'll go back to log scale because it's a little easier to see. But you sort of see how some of these counties, Coconino, some of these other counties, they started out here at very fast clips. And those are where the initial infection rates were. And then you can see our second sort of wave of infections came from the south, Santa Cruz, Yuma. And now the rate of infection is starting to increase in central Arizona, Yavapai, Maricopa County, Pinal. So you can sort of use this chart to see how the shift in the infections have sort of taken place over the course of time.
And Garrett, this is a chart that you built yourself with the numbers that are supplied by the state?
Yes, but anyone can build a similar chart. You know, I'd like to take full credit with it, but I use this Flourish company and these are free charts, so you can build similar charts.
Yeah, it's fascinating, and it helps us better understand how things have changed over time. One viewer wants to know if this is currently being broadcast on ABC 15. This is not. This is only on our Facebook page, and we appreciate all of you who have joined us on here. We've been doing this for about a week now, and are overwhelmed at the number of people who are joining us to better understand the numbers. We just want to help you make the best decisions for your family. And we don't want to tell you how to do that. We want to show you where those numbers are so that you can evaluate things for yourself and make your best choices. So thank you so much for spending time with us each afternoon and getting to understand this stuff a little bit better. Marisol just wrote in a few seconds ago. She wanted to know about travel. You're allowed to travel at this point. There are some states that have us under quarantine for 14 days once you arrive. The tri-state area, so New York, New Jersey, and Connecticut, I believe, is that the third state in the tri-state area? My brain's already off. It's like a Friday. California or Texas, that's where you're most asking about. There are no travel restrictions at this point that we know of in either of those two states. Both states dealing with some high numbers as well. Two other places that are going to limit your travel when you arrive from Arizona are Kansas and Hawaii. Hawaii has had strict regulations in place this whole time. So it's something of note, something to check on before you do head out. Marisol, safe travels out there. And the other thing I always tell people to check is be sure to understand the masking requirements in the city you're headed to. So some of these requirements came earlier in California, and I would hear of people traveling out there thinking they're going to have the expectation of a normal summer beach vacation. Some of the LA beaches have been shut down. Things are changing. So just be sure you know what you're getting into before you're renting a place out there, that you know what the rules are before you have a maybe disappointing vacation out there because it wasn't what you expected as far as masks or what you plan to do when you get there. So thank you for that question, Marisol. Safe travels as you head out there. Garrett, what other numbers were you especially interested in today? I know we first talked about some of these changing numbers in the lab reporting late, and also the number of deaths that came in. What other numbers were you watching closely today?
Two of the close numbers that I'm watching today, and I will share the screen again so that people can see them as I'm talking about them, which are interesting, is we're watching the hospitalization. This is a very important curve. As some of you may know, yesterday the AZDHS, pardon me, allowed for the hospitals to start, they have the ability to activate crisis care right now. And so this is the most important sort of metric we have to watch what's happening as far as capacity. So this is the number of COVID-19 patients. As you can see, starting about May 26th, this number started to increase at almost an exponential rate. What we're watching right now is that, as you can see, while it is still increasing, the slope has started to slow down. This is a sort of sliver of hope in these numbers, because this slope also is, the slowing down of the slope is also showing up in the ICU numbers. So we're hoping, by looking at these numbers, that we're going to start hitting a peak in ICU and inpatient beds. If we look at the ICU actual raw census numbers, you can see that hasn't gone up exponentially, or hasn't really gone up at all in the last several weeks. June 23rd is when it's been fairly stable since June 23rd. So comparing these two numbers, seeing if this hospital curve on these metrics begin to slow down, this is all stuff that we need to know. So and it's very, very important as to where we're going. And you can see it's also happening in ventilators, and the emergency room has also dropped off pretty much as well. And these are all extremely important numbers to watch over the course of the time to see if this is a sort of anomaly, if it's a situation where there are other, I can see in emergency rooms that's a good one to show what's happening exactly in real time, because that's the number of COVID-19 people that are checked in the emergency room. So having that drop right now, that might start to be reflected in the case numbers here soon. So again, we're seeing some sort of sliver of hopes in these hospitalization numbers.
Yeah, one of the we were talking about was the possibility of plateauing some of these numbers, that, maybe not necessarily seeing a peak where it would drop back off right away, but perhaps seeing it leveling off just a bit in some of them.
Yes, and we may start seeing a leveling off in the case numbers, but we have to be very careful with that, because that could be a situation where we're leveling off because of capacity issues for SonoraQuest and other labs to process their daily processing capacity. We've been sort of stuck at 15,000 for about a week and a half now. So if that number stays at 15,000 and we're still getting these percent positives in the 20%, we're obviously going to start showing a leveling off of cases, but that doesn't necessarily mean that we're seeing a lessening of COVID. It just might simply be because of the number of tests we're able to complete. So we're going to be watching that, and also what the percent positive rate is in sort of conjunction with that, and seeing if that percent positive rate goes down.
Yeah, it's fascinating to watch all this. Yeah, we really have been kind of limited at 15,000 tests per day. That we really haven't seen it go much above that.
No, I'll show the epi curve really quick on the testing. If you just give me one moment.
That's fine. And then I have a question coming in from Twitter as well that we'll get to about the bulk of new cases after that.
Okay, so let me go to the testing epi curve. I'm sorry, you're looking at my internal stuff here. So this is the testing epi curve, and you can see that we sort of right here at this 15,000 to 13,000 mark. These are filling in pretty quickly, as you can see. There's even this is the 7-day mark, and even we went from about 13,000 to 16,000 tests just on that day. So these are filling in very aggressively right now. But they're sort of, as you can see, since then, about staying in this sort of low 13,000 range, getting into the 17,000 range. But we need to see what happens with these numbers right here. Are we going to be closer to here this week? Are we going to be closer to here? So this is very important to watch to see what our capacity is in this state.
Yeah. Scott Beeson writes in on Twitter, are the bulk of new cases actually from antibody tests of people who are fully recovered? So once again, since people are not able to see this question, I'm just going to read it one more time. Are the bulk of the new cases actually from antibody tests of people who have fully recovered? We have it split. Our numbers come in so that we can see who's taking a PCR test or a diagnostic test versus who's taking one of these serology or antibody tests to see if they've had COVID in the past. That breaks down on the Arizona Department of Health website.
Yes, and I'll just show you that curve really quick on a weekly basis. If you want to find out the answer to that, and the answer is no, it is not the bulk of the cases coming from antibodies. These are the two graphs you want to look at. PCR is the diagnostic nasal swab. This is the number of tests that were collected for the nasal swabs, and this is the percent positive. So you can see last week is a great example. 67,000 tests were collected last week, and 20% of those tests were positive. So that's the bulk of the cases right now. These antibody tests, it's a much lower number. 15,000 antibody tests were collected, but only 4.8% of those were added into the system as a positive case. So there are some, as you can see, there are about 5% from last week, for example, that are in the case system and will be someone who has antibodies rather than actively carrying the virus, but it is not the bulk at all by any means.
So the number that we were seeing on the left, if we can go back to your screen, that number is the percent over time. I hope it's on the left on your screen as well, but that is the percent over time, and then you can drill down into the specific weeks to go week by week, and that's why you see that increase going along on those PCR tests. The serology tests, interestingly enough, really
it has not changed very much. No,
that much.
It's always a little higher. So all of the tests are always a little higher on the date with the less amount of tests. You see, there's only 20 tests, and 5% of them came back positive. But serologies have kind of sort of stayed at this 3.1% for quite some time. Whereas the PCR tests, they've increased not exponentially, but they've increased by a good amount over the past several weeks. I mean, when the lockdown order was ended, we were posting on a weekly basis 7% positive, and then 5% positive, and then another 5%, and then it started to go up from there.
I want to get to a question that Christy just wrote about the ages. She's curious about the ages. We can show that, and Christy, you're able to find this on the site as well. She heard the number of positive is 22 to 44. I'm assuming she's referring to ages there, but let's show her where we can.
Yeah, I'll show you where to find that. I do have an interesting graph on that too that I can show you in just a moment. But here is the age breakdown. As you can see, the vast majority 49% of cases are coming from 20 to 44. 11%, so more than half of the cases coming are from people under 45 years old right now. And then these are the numbers for the older folks, and we're about 12% of the cases, a little under 10,000 for 65 plus. That's a high risk category, 9,000 for 55, 64. So this is where you find it in the demographics. So I'm going to stop sharing this for a moment because I'm going to move to another graph. It's just going to take me a second to pull up.
That's okay, and I want to let Jessica know. She just asked a question. Jessica, we'll get to you in just a moment. She was asking about some changes with the lockdown. So she said she's sorry for repeating it. She's late to the party. I'm just happy she's calling this a party. So Jessica, welcome to the party. We're happy to have you along with all our other viewers out there right now. And we'll get to your question in just a second as soon as we answer Christy's question about the ages.
So this is a visualization of each of those age groups we just went through over time. And as you can see, this is the 25 to 64 or 20 to 44-year-old category, and this is that May 26. And while all of these sort of follow, everyone's going up. No one's going up at the same rate of growth as the 20 to 44-year-olds. So you can see in this how when we started early on, even though the 20, 44-year-olds were a larger percent even then, it's really not considerably larger than some of the other age categories. It becomes considerably larger in June and coming in July.
The question that just came in from Jessica about the lockdown, will Arizona be going into a mandated lockdown again? We didn't get to that question yet. All we know is that new restrictions were put in place just yesterday at about 3 o'clock, and that was changes to bars, gyms, movie theaters, most of which had not opened yet but had planned to this month. What else did I forget, Garrett? Schools being pushed back. So those have been, the first things I mentioned have been shut down for a month. They're going to be closed for 30 days, and then there's going to be a closer look at the metrics and all of this and whether those places can reopen again. So that happened.
The water park and tubing.
Yep, that was the other one. Sherry wrote in a question about the deaths in one day. Which day at this point, I know some of them are backfilled, which day at this point has been our deadliest day, sadly, in this fight against COVID?
I'll give you the actual deadliest day. So let me pull that again. We'll go back to the AZDHS dashboard. We're going to go to COVID-19 deaths, and this will show you the peak death day, which there are two on June 15th and June 16th. There were 33 deaths respectively on those 2 dates. So as of right now, those are the 2 deadliest days that we've had. The concerning part about that is that these 2 days are pretty far on the right hand of the curve. And as I said before, the death curve takes a lot longer to fill in than some of the other curves. So that means that we're sort of not out of the woods yet, and that you would have wanted to see these numbers sort of farther back here where they're not going to be touched. That means that there's potential for a lot of growth in these here.
Zoran is asking, if you take a test more than once, are they counted each time as a positive result? Thank you for that question. They are not. The positive tests have been worked to be deduplicated, so they are not showing up more than one time. So that was a question a lot of people had, and we just got answered 1 or 2 weeks ago from the health department. So that helped people have a bit more confidence in some of the numbers that were coming out. Garrett, when you were just on this last page, if you could scroll up a little bit of the Department of Health website, actually scroll down, sorry. There were a few more spots of information on demographics. It went to age, and then there were some other areas that had a little bit more information, chronic medical conditions and high-risk individuals. We're getting a bit more information on who these people fighting this are.
Yeah, so as you can see, this is the case data, but as you can see, this chronic medical condition, about 20% of the cases have a chronic medical condition. High risk, 65 plus or 1 chronic medical condition, that's how they define that, and that goes to 27%. So the majority of the cases are not of people who are high risk at this point. but we can go. This also exists on the. It does not exist on the death curve. It does in Maricopa County, so my apologies for that. But if you go to, I'll take you over to Maricopa counties, and they actually do have that information for deaths as well.
Yeah, for those of you who are watching or interested in the numbers, specifically in Maricopa County, as Garrett moves to that page, there's a lot more information, a lot more data that you can dive into to learn about the people who are fighting this, and a deeper dive into the numbers, if you will. Someone asks while you're pulling that up, can you tell us which COVID they are testing positive for, 19 or 20? This is still 19, based on 2019. So
yes. Okay, so let's go. I found it, so I'm going to share the screen again. So this is the Maricopa County numbers for these chronic medical conditions. And you can see it goes all the way from cases hospitalized, ICU, as well as death. And you can, it gives the age and then also the chronic medical condition. So in Arizona, or excuse me, in Maricopa County, 67% of those who have died have a chronic medical condition. 92% of the deaths have come from 65 years and older, or at least one chronic medical condition. As you can see, that's also the majority of hospitalizations as well as ICUs. So, but also in the same manner of the state, the majority of the cases themselves, are, as we would expect, are not from chronic medical conditions. It's only 18% are high risk of the cases, 11%.
Yeah, you know, it's interesting because I hear from people who say, wait, I'm seeing a different percentage. I'm seeing a different percentage. So it's important to remember whether those numbers are coming just from Maricopa County or from Arizona State as a whole. I had a question specifically emailed from a viewer about the percentage of hospitalized COVID patients, and the number I gave him is from Maricopa County, and then he was confused because he was looking at the state health department. So you're going to get some very different numbers that you want to take a closer look at specifically.
Yeah, Maricopa provides a good amount of data, so it's very easy to confuse the two, because obviously Maricopa is much larger than every other county in the state, so the numbers will somewhat be reflective of statewide numbers.
Right. A lot of people are asking about the 4th of July. It is a holiday already. I can't believe that it's already the 4th of July. We've been tracking this thing since January 17th. So I just can't even believe we're here already. Some cities have canceled their 4th of July fireworks after Governor Ducey's order yesterday. Others are going to go on just as they had planned. We are just learning this afternoon that Scottsdale's fireworks are still on. So we want to let you know that you can find out a little bit more information about what's planned in your area on our website right now, and that's on ABC15.com/coronavirus. There's details. We're working to reach out to all the organizations to find out whose fireworks are still on and who's changing their plans because of the information that we learned from the governor yesterday, and working to limit the size of groups that get together out there. So just have a safe holiday, but know that you can find out a little more information there on our website about what your plans can be. Any other things you wanted to dive into, Garrett? We've already been talking for about 35 minutes here, and I want to let people get back to their day or answer any final questions that are just coming in to our chat here. And we appreciate every single one of you hanging out with us today, and hopefully we're helping you find the information you would like to check each day. One tip I always give is putting a bookmark at the top of your screen, because it can be daunting to dive into these websites and click so many pull down menus to get to the specific spot. What were you watching also closely today?
I'll just bring people to, I saw this on the questions. So I'll bring people really quick to the zip codes as well. That's a very useful metric to look at. And that can be found right here in this zip code. It's going to take you outside into a new window. But this is on AZDHS.gov, and this is the state's zip code map for all of the coronavirus cases by zip code, and this is using, of course, census zip code numbers. They have greater than 250 as their highest gradient, and as you can see, unfortunately at this point, almost every zip code in Maricopa County has a gradient of over 250 cases. So if you look at these numbers here, you can see, I know that this particular one is one of the higher ones in the state. one of the absolute, in fact, the highest in the state right now is still down here in Yuma. This zip code right here is the highest zip code of coronavirus cases, 2,290 cases, followed closely by this one right here at 1992. So Yuma is still a very hard area, but as you can see by the coloring of the map, Maricopa County is also has a pretty high density of cases as well.
One of the questions coming in from Holly. Holly with a Y. I want to make sure we get to your question. I know you've asked a couple times. She was asking about the boutique studios for working out. As far as the governor's executive order, and you can look at it over on my Facebook page, Holly, and the whole executive order is right there, and you can read through it. As far as the gyms, it is saying indoor gyms must close. Period. It didn't have any other information about size or some of the smaller boutique studios that have maybe 10 or 15 people or even less working out. The governor's order, as it pertains to gyms, was literally one sentence. It said indoor workouts closed. I mean, it was super short. Look at my Facebook page. Just go a few posts back to yesterday, and you'll be able to find all of that. There's the address, facebook.com/news from Katie, and you'll get all the info right there that the governor put out. We have heard from gyms that are defying the order. Obviously, we're only 24 hours out. We don't know what will happen with that, but we are hearing of that in some cases, and other places saying they're just gonna stay open. So obviously, it's something we'll keep reporting on. And Kristen's asking, where do dance studios fall under the new orders? We've seen people trying to put the studio under youth sports and follow youth guidelines. And we don't know what's going to happen next. We don't know if they're going to come out and say something about that, but that's how we're seeing some places that are trying to get around the order. A lot of the smaller studios for children won't even let the parents come in. They make the parents stay outside if the kids are going in there. So Holly's writing, thank you. Yeah, it's super general. It will be interesting to see what happens. I absolutely agree with you. It's something we're going to be reporting on tonight. We'll stay on it. As soon as we heard this yesterday, we saw some of them say, oh, we're technically a spa. We're technically a youth kids sporting event. So they were all finding different ways to try to stay open. But we'll see how that works out and what the governor says about that, or what he chooses to do with that. So we'll stay on that. Gosh, so many good questions coming in. I so appreciate that. Garrett, was there anything else that you saw that came up that you want to make sure we get answered?
No, I didn't.
Okay. I want to thank everybody for joining us on here. We could stay all day and talk about this. Garrett and I love numbers, and we love diving into it. Oh, I saw one that came up a couple times. Mojave County, was that on your chart for?
Yeah, it's on the chart. And again, I'll put this on my Twitter, but it's hidden in the case per capita because it's hidden behind one of the cases. It's hidden behind one of the other counties. So that's one of the problems with the density, with the case per capita, since they're closer together. Right. It's harder to tell. There are 1,071 cases in Mojave right now. Their days to double is 22, which as far as the other counties right now are concerned, 22 is a pretty respectable day. It has not increased substantially, at least the case per doubling, for quite some time. So that's just something to consider right now.
And can they take a closer look at that chart? That is on your Twitter account, right? I know.
I'll share it really quick. I'll just share it on here, but it's going to be on my Twitter account. This is the COVID growth chart for all the counties, and you can see there's Mojave right there at a 22-day doubling. And then you can, and why people were asking where Mojave was is because it's harder to see on this particular chart because it's hidden they're so close together. But you can find it there. There'll be a link there. And I usually post this chart almost on a daily basis on Twitter anyway, with every update. Okay. Recovery question. So I guess we'll just really go quick through the recovery question again. The state does not define recoveries. They do not have a data point on AZDHS that defines recoveries. What you may have seen recoveries on Johns Hopkins, World Meters, any of those other places. What you're seeing is the hospital discharge number. That is the number that those organizations have decided to use as a recovery number. We are not pulling that trigger. The recovery number is actually likely higher than that, but there's also problems with using the discharge number. So we're choosing not to use that as a recovery number and working with trying to figure out the best way to figure out a recovery number until and unless the AZDHS begins to report on a recovery number.
Yeah, one of talked about in days is that everybody's definition of recovery is not something that can be agreed upon just yet with a new virus like this. So the latest number they had was over 9,000, but that's that could just be discharges, like you said, in other ways.
And discharges also include deaths. I mean, that's just reality. So it's when a bed is discharged, a bed is discharged. So this is why there's problems with using the hospital discharge number as a recovery number.
I know that people have more questions, and gosh, we could stay all day. And I'm sitting on the floor in my son's bedroom where I do our newscast from. I'm actually headed to the station in a few minutes because I'll be anchoring from there tonight. We want to get to more of your questions. We want to help you find the answers to these things. So listen, we're going to be back tomorrow around this time. We'll be right here on Facebook. If you have a question you really want help finding the answer to, go to my Facebook page and post it there. Again, facebook.com News from Katie, and we'll make sure to get to your question tomorrow, or we'll make sure to find it somewhere for you and help you get to these answers so that you're able to look them up each day. And we just want to teach you and help you be able to find these things so that you can find them on your own. So Garrett, thanks for taking time. So appreciate it. And thank you to everybody who's been joining us on here. Jennifer, you're so welcome. We're just happy you're joining us on here. And so thank you for saying thank you, because that means a lot. I hear my kids knocking at the door, so I'm going to go help them and find out what's going on in my house. You too, Garrett. So thanks again. And we'll see you all back here tomorrow for another deep dive into the coronavirus numbers. And remember, all your latest coronavirus information on abc15.com/coronavirus. And we will see you on the news later this afternoon, our first newscast at 4, 5, and 6 p.m. And of course, tonight at 10. Thanks, everybody. Thanks, Garrett.
Thank you.